Hello everyone. So in this session, we are going to discuss anatomy questions related in the GT4. So let's start with the discussion. So we will discuss all the anatomy related MCQs being asked for the grant test for NEET MDS. So let me start with the first MCQ. Grade 1 axillary lymph nodes are located. What is the location of grade 1 axillary lymph node? Whether it is located medial to pectoralis major muscle, whether it is located lateral to pectoralis major muscle, medial to pectoralis minor, lateral to pectoralis minor. So actually for solving this MCQ, I would like to clear you one point that pectoralis minor, if I am talking about the pectoralis minor muscle, it is the key muscle of the axillary region. Why it is called as the key muscle of axillary region? Because in relation to this, we can divide the axillary artery into three parts, and also we can define the location of axillary lymph nodes. So that is one of the important point which you have to know. So exactly अगर हम grade की बात करें तो there are three grades of axillary lymph node, grade 1, 2 and 3, and grade 1 axillary lymph node is located lateral to pectoralis minor muscle. Now, according to the dissection of axillary lymph node and following level 1, 2 and 3, the location is defined as following. So, अगर हम level 1 की बात करें तो it is located to the lateral border of pectoralis minor muscle at the apex of the axilla. So, only lateral to pectoralis minor has been marked as the right answer. अगर हम level 2 की बात करें तो it is located medial to pectoralis minor muscle. Level 3 extend beyond the medial border and ultimately it reaches at the point where axilla is limited by the first rib. So definitely these are the levels of axillary lymph node, and how it is classified must be known to you. Other than that, I would like to show you an image for it. Level 1, lateral, infralateral to pectoralis minor muscle. Level 2 is posterior and it is central group of axillary lymph nodes. Level 3 is the apical group of axillary lymph node, which is shown here, and you can just locate these locations of axillary lymph node and can classify. Now, other options which is wrong, medial to pectoralis major muscle was one of the option. Exactly, pectoralis major is not considered for dividing the axillary lymph nodes in the level. So definitely जहाँ भी pectoralis major muscle है वो wrong होगा. और अगर मैं medial to pectoralis minor बोलूँ, that is also wrong because it is not regarded as level 1 axillary lymph node. Okay, अगर हम supromedially जाएंगे तब level 3 axillary lymph node होगा. So definitely it is wrong only. So definitely after this discussion, it is quite clear lateral to pectoralis minor is the right answer. Now, general visual efferent component is found in all except. So general visual efferent component, whether it is found in all except. So we have to see the odd man out which is not containing general visual efferent component. We have got oculomotor, glossopharyngeal, facial and olfactory. These are the four options and we have to mark the right answer. So यहाँ efferent components की बात हो रही है. Definitely the right answer is olfactory nerve because it is having afferent component. It is not having efferent component. So let's see. The olfactory nerve, which is regarded as the first cranial nerve, is the first and the shortest cranial nerve. अगर हम उसके कोर्स की बात करें तो olfactory nerve is the shortest cranial nerve and it is a special visceral afferent nerve which is related with the sense of smell. So before moving on to the next MCQ, I just want briefly, you should have a quick revision of this component. So olfactory nerves, if I talk about olfactory nerve, it is having special somatic afferent component. Optic is also having special somatic afferent component. और अगर हम oculomotor की बात करें, it is having both special somatic efferent and general visceral efferent component. Trochlear nerve is having somatic efferent. Trigeminal nerve is actually trigeminal nerve is a mixed kind of nerve. It is having both motor and the sensory components. So it is having general somatic afferent and also special visceral efferent component and general somatic efferent. Facial की बात करें तो facial nerve is having all these components: general somatic efferent, then general visceral efferent, special visceral afferent and special visceral efferent. Vestibulocochlear nerve is again having special somatic afferents. Glossopharyngeal is again a mixed nerve having both efferent and afferent components. Vagus nerve is also a mixed nerve. Accessory nerve is having special visceral efferent component. The motor one, the spinal accessory, because the cranial accessory is running along with the vagus nerve. Hypoglossal is also having somatic efferent component. So after this tabular discussion, it is quite clear the right answer will be olfactory. All other nerve is having efferent components, general, visceral, efferent component, but olfactory is having afferent components. So done with this. Now let's move on to the next MCQ. Anterior choroidal artery is a branch of, the options provided is anterior communicating artery, internal carotid artery, external carotid artery, or anterior cerebral artery. So if I am talking about this anterior choroidal artery, it is quite clear. I would like to tell the correct answer will be ICA, internal carotid artery. Internal carotid artery is a source of blood supply to the brain, and anterior choroidal artery is a branch from the source of internal carotid artery. I would also like to tell you about the branches of internal carotid artery in brief. Let's talk about that. So अगर हम internal carotid artery की cerebral part की branches की बात करते हैं, so actually if I am talking about its course, so internal carotid artery is having a course, it is having a course in the traversing through the cavernous sinus, how it is entering into the brain. So after piercing the dura mater of the roof of cavernous sinus, the internal carotid artery is giving following branches. So it gives altogether in the cerebral part, the internal carotid artery is giving 5 branches. The first 3, ophthalmic, anterior cerebral, middle cerebral. So exactly, anterior cerebral artery is a major source of blood supply to the medial surface of the brain, and middle cerebral artery is a major source of blood supply to the superlateral surface of the brain. Ophthalmic artery is giving the blood supply to the orbit content. So these are the 3 branches. Other 2 branches which cerebral part also gives 2 smaller branches which is supplying the other part. So we have got posterior communicating and anterior choroidal artery. So exactly इस question में क्या पूछा गया था about anterior choroidal artery. So all these are the 5 branches. As in this image also you can see internal carotid artery, it's a branch from the common carotid artery. Common carotid artery bifurcation takes place at the level of C4 cervical vertebra, and the internal carotid artery forms a major source of blood supply to the brain structures. External carotid artery will give blood supply to the neck region, and many important branches are given from the external carotid artery, like we have got many branches are given. Okay, so there are altogether 8 branches, and in the previous session also I have discussed about all that 8 branches. If you remember, there is a mnemonic also. Some anatomists like freaking out poor medical students. We have got 3 anterior branches, that is facial, superior thyroid branches, lingual branches, 1 medial branches, ascending pharyngeal artery, 2 terminal branches, superficial temporal and that of maxillary artery, 2 posterior branches, posterior auricular and occipital artery. So we are not going into the discussion of external carotid artery, but यहाँ पे क्या पूछा गया है, internal carotid artery के बारे में पूछा गया. So we have got 5 branches as you can see in this diagram. Ophthalmic artery, anterior cerebral, middle cerebral, posterior communicating, and the other one is the anterior choroidal artery, which has been asked in the exam in this MCQ, anterior choroidal artery. So got this? Let's move on to the next question. Question number 4. In which stage of meiosis the primary oocyte is arrested? 4 options are there: prophase, metaphase, anaphase and telophase. ठीक है, 4 ऑप्शंस है. यू हैव टू मार्क द राइट आंसर. कौन सा वो स्टेज है मियोसिस के जहां पे प्राइमरी oocyte अरेस्टेड रहता है. ओके, दिस इज व्हाट वी हैव टू नो. सो एग्जैक्टली इन ब्रीफ वी विल टॉक अबाउट द meiosis stages. So exactly अगर हम बात करते हैं प्राइमरी oocytes की, to when it is actually begins the meiosis, as we have already discussed in the embryology part ki meiosis started the process of oogenesis started quite before birth in case of females. But if I talk about the meiosis in the fetal stage, it is arrested in the meiosis 1, prophase 1. Which stage? In the prophase 1 of the meiosis it is arrested. When the female is in the puberty, the process of oogenesis started. So exactly what happens, the primary oocyte completes the process of meiosis 1 to form large secondary oocyte and the first polar body is released. So definitely arrest यहाँ पे पूछा गया था, तो prophase 1 is the right answer. What is the right answer? Prophase 1 is the right answer. So in brief you can see before ovulation, so exactly अगर हम बात करें तो puberty में ovulation start होता है, लेकिन before birth only the oogenesis process start. Mitosis के बाद primary oocyte is released, that is arrested in prophase 1, which was asked in the MCQ. Thereafter, first polar body is released, meiosis continues. Now, secondary oocyte arrested in this in the metaphase 2 stage, and that will complete just with the ovulation, before the ovulation, and after that the fertilization occurs and the polar body second is released. So you can see primordial germ cell enlarges, mitosis, oogonium is formed. Primary oocyte enters the prophase first of the meiotic division, which is enlarged, which is continued, and it is arrested in prophase 1, completes the first meiotic division just before ovulation. Just before ovulation, secondary oocytes form first, and thereafter secondary oocytes also complete their will be entering in the meiotic stage, but it will be also completed once the fertilization takes place and the second polar body is released. So we have got the right answer. Definitely after this discussion, it is quite clear that A, prophase, is the right answer. Now, superior parathyroid gland is derived from which component? The option provided is, it is derived from the mesoderm of third arch, it is derived from the endoderm of third arch, it is derived from the mesoderm of fourth arch, it is derived from the endoderm of fourth arch. 4 options are there and you have to mark the right answer. Okay, superior parathyroid. So if I talk about superior parathyroid gland, so actually both parathyroid glands are derived from third and fourth pharyngeal pouches. So the best answer is endoderm of the fourth arch. Okay, pouches are endoderm. So endoderm of fourth arch is the right answer. Embryologically, अगर parathyroid gland की बात करते हैं, तो they are derived from third and fourth pharyngeal pouches. As I told you, the third pharyngeal pouch give rise to inferior parathyroid gland, and the fourth pharyngeal pouch, if I talk about the fourth pharyngeal pouch, it is giving rise to the superior parathyroid gland. The third pharyngeal pouch is giving rise to inferior parathyroid gland along with the thymus gland also. Now, I would like just everybody to go through this because this is very important for your entrance exam, that you should know the derivatives of all the pharyngeal pouches. So, यहाँ पे आप quickly revise कर सकते हो. Okay, let me just, yeah. The first pharyngeal pouch derivatives are tympanic cavity, auditory tube, inner aspect of eardrum. The second pharyngeal pouch forms the tonsil, palatine tonsil, tonsillar fossa. The third pharyngeal pouch, as I told you, the third pharyngeal pouch is not only giving rise to inferior parathyroid gland but also thymus gland. The fourth pharyngeal pouch is forming the superior parathyroid gland, and the fifth pharyngeal pouch will lead to the formation of ultimobranchial body. So done with this. Now, what about the other options? The other options are wrong, like mesoderm of third arch is wrong. Exactly, agar mesoderm ki baat kare, to it is giving rise to muscles. So the muscle of third pharyngeal arch is just one, that the stylopharyngeus muscle of the pharynx, and the nerve of third pharyngeal arch is glossopharyngeal nerve. So it is wrong. Mesoderm of third arch is forming stylopharyngeus muscle, so it's the wrong option. Endoderm of third arch, agar endoderm, the third pharyngeal pouch, agar endoderm of third arch की बात करते हैं, तो it is giving rise to the third parathyroid gland or inferior parathyroid gland and the thymus gland. I think that was not asked, so it is also wrong. What was asked was fourth. What was asked was superior parathyroid gland. That means it is a superior parathyroid gland which is derived from the endoderm of fourth arch. Now, mesoderm of fourth arch. Mesoderm की बात करते हैं, तो mesoderm again forms the muscles. And if I talk about the muscle of the fourth arch, it is the constrictor muscles of the pharynx along with the cricothyroid muscle. So, of all the intrinsic muscles of the larynx, only cricothyroid muscle is a muscle of fourth arch. All other intrinsic muscles of larynx are derived from the mesoderm of sixth arch. So definitely the mesoderm of fourth arch is not the right answer, and the nerve of fourth pharyngeal arch is the superior laryngeal nerve. Branch of it, external laryngeal nerve, is giving innervation to cricothyroid muscle. Okay, let's move on to the next question. That is question number 6. Cells in the innermost layer of the retina. What is the term used, or the cells is designated, which is the innermost cells in the retina layer? We know retina is having 10 layers from outside to inside, going more closer to the vitreous. So, amacrine cells hai, rods and cones hai, Muller cells hai, and ganglionic layers hai. We have to mark the right answer. So, retina is primarily made of 3 layers of the nerve cells. Okay? Retina is primarily made of 3 layers of nerve cells. They are ganglionic cells, bipolar and photoreceptor cells. अगर हम ganglionic cells की बात करें, ganglionic cells are present very close to the vitreous body, and so only I told you ganglionic cells are the right answer. Okay, I told you ganglionic cell is lying very close to the vitreous body, so it is the right answer. The primary light sensitive layer is photoreceptor cells, which is made of rods and cones. So definitely you have to know the name of all the 10 layers of the retina if we slightly enlarge. The first layer is the pigment epithelium, having cuboidal epithelium as the lining layer. Then we have got rods and cones layer, external limiting membrane, outer plexiform, then the inner and the nuclear and plexiform ganglionic cell layer. Then we have got the axons of ganglionic cell layer forming optic nerve and inner limiting membrane. So only ganglionic cell is more inside and it is more innermost, so it is the right answer. Other than that, you can just have a look on this retinal layers where you can just have a quick recapitulation of all the layers as outer aspect choroid, the retinal pigment layer, layers of rods and cones, outer nuclear plexiform, then we have got inner nuclear, inner plexiform ganglionic cell layer, as you can see, is lying very close to the inner fiber and the internal limiting membrane. So the inner layer we have to mark ganglionic cell as the right answer. Done with this? Now we will talk about the next question, that is question number 7. Secretomotor fibers of lacrimal gland relays in. Secretomotor fibers of the lacrimal gland is relaying in geniculate ganglion, pterygopalatine ganglion, otic ganglion और trigeminal ganglion. ठीक है. So अगर हम lacrimal gland के secretomotor fibers के relay की बात करें तो that is definitely pterygopalatine ganglion is the right answer. So let's come with the discussion of it. Parasympathetic secretomotor neurons stimulate the secretion of lacrimal fluid, tear fluid. Preganglionic parasympathetic fibers of central nervous system will reach the pterygopalatine ganglion, which is also called as ganglion of hay fever, via greater petrosal nerve, which is a branch of facial nerve, and this will join with the deep petrosal nerve to form nerve of pterygoid canal. So exactly, pterygopalatine ganglion, which is also called as sphenopalatine ganglion, ganglion of hay fever, innervates the lacrimal gland, the blood vessels of the eye, the secretory glands, blood vessel, nasal cavity, palate, and that of the cerebral blood vessel. So basically, the correct answer for lacrimal innervation, we will definitely choose the sphenopalatine ganglion or pterygopalatine ganglion as the right answer. Now, अगर हम geniculate ganglion की बात करें, it's wrong because it is pseudo unipolar neurons and it is located very close to greater petrosal nerve, and it is mainly it is the it is and it is lying at the anterior third facial nerve genu, internal genu. So definitely it's not related with lacrimal gland secretion. Otic ganglion is also wrong because aortic ganglion is related with the secretions from the parotid gland, not from the lacrimal gland. Trigeminal ganglion की बात करो तो it is the largest cranial nerve ganglion. It is also not related with that of the secretions from the lacrimal gland. So it is also wrong. We will go with pterygopalatine ganglion as the right answer. Let's move on to the next question. Question number 8. Buccal branch of facial nerve supplies. अगर हम buccal branch of facial nerve की बात करते हैं तो it is giving innervation to buccinator muscle. It is giving innervation to buccinator and orbicularis oris muscle. Buccinator and superior orbicularis oculi, buccinator and inferior orbicularis oculi. So अगर हम buccal branch of facial nerve की बात करें तो definitely if I have to choose the right answer, I will go with buccinator and orbicularis oris muscle. Okay, that is the right answer. So actually, if I talk about the 5 terminal branches of facial nerve, which is traversing from the anterior border of the parotid gland, like that of a foot of duck, like that, and that appearance of the nerve bifurcation, which is seen at the anterior border of parotid gland, is called pec sensorineural. So it is giving a temporal branch, it will give zygomatic branch, it will give upper lower buccal, it will give marginal mandibular and cervical. These are the 5 terminal branches. So यहाँ पे temporal branch की बात करें तो it is mainly giving innervations. Temporal branch is giving innervation to frontal belly of the occipitofrontalis muscle and upper part of orbicularis oculi muscle. Zygomatic is supplying orbicularis oculi muscle lower part. Buccal branch, which has been asked in the MCQ, is giving innervation to buccinator, orbicularis oris, and also innervate zygomaticus group of muscle, zygomaticus muscle. The marginal mandibular will supply depressor labile inferioris, depressor angulae oris, and mentalis muscle. Cervical branch की बात करें तो it is giving innervation to platysma muscles of the neck. So in short, I would like to tell all these terminal branch of facial nerve is innervating the muscles of facial expression. Temporal, as I already told you, it is giving innervation to frontalis muscle belly. and orbicularis oculi and corrugator superciliary. Zygomatics, lower part of orbicularis oculi. Buccal was asked in the examination in this MCQ, and it is giving innervation to orbicularis oris, buccinator, zygomatic. Marginal mandibular innervase, depressor labile inferioris, depressor anguli oris mentalis, and cervical is giving innervation to platysma muscle. So here exactly you can see the 5 terminal branches: innervation, temporal, zygomatic, buccal, marginal mandibular and cervical. So quickly you can revise all the muscles of facial expression getting innervation from these 5 terminal branches of facial nerve, which is asked in the MCQ. Okay. Actually अगर हम buccal branch की बात करें तो there is 2 buccal, upper and the lower buccal, and between upper and the lower buccal the parotid duct or Stinson duct is traversing. Now let's move on to the next question, that is okay, before that I would like to strike the incorrect answer. Sir, buccinator, agar one of the option was just buccinator, yes, buccinator muscle is getting innervation, but other than that, other muscle orbicularis oris is also getting innervation, so it's wrong. Buccinator and superior orbicularis oculi is getting innervation from temporal and that of zygomatics. And inferior part of orbicularis oculi is getting innervation from zygomatic. That I already told you. Agar orbicularis oculi की बात करें तो upper part from temporal and lower part of orbicularis oculi is from the zygomatic branch of facial nerve. So these are wrong. Let's move on to the next question, that is question number 9. A factory worker presents to the emergency department with a hand injury. The patient complained that while working, his hand got stuck in a machine and got crushed. The patient was taken to the emergency room and the surgery was performed. The operating surgeon suggested that the nerve damage was very extensive and needed an autologous nerve graft to recover some degree of neuronal functions. Which of the following areas supplied by the nerve is ideally suited for the autologous nerve graft? So, okay. So that is what has been asked in this MCQ. So basically, to mark the right answer is that nerve suited for autologous nerve graft is the keyword. Okay, areas. And areas के लिए हमें ये image को enlarge करना है, and we have to first identify what is area number 1, 2, 3 and 4, and we can mark the right answer. Actually, before that, I just want the reason supplied by sural nerve is considered ideally for the nerve grafting. Okay, sural nerve. That is, sural nerve is basically a nerve which is giving innervation to the lower part of the leg. So exactly sural nerve L4, L5, S1 is a cutaneous sensory nerve which is giving innervation to posterolateral calf innervation, cutaneous innervation in the distal aspect of the lower leg. So exactly formation of sural nerve should also be important for you to know. Actually, it is a cutaneous nerve which is formed by medial sural nerve and sural communicating nerve, which is in continuation joined with the lateral cutaneous nerve and travels as the sural cutaneous nerve. It innervates and gives innervation to lateral cutaneous area for the posterolateral aspect of the leg and the lower ankle and via its lateral calcaneal branches. So exactly you can just, I'm just enlarging this image where you can see the sensory distribution of the important nerves has been shown. So we can see saphenous nerve is giving innervation here onto the medial side. Sural nerve is this yellow color area which is designated as area number 1 is the area of innervation by sural nerve, which is the right answer here. And the area number 4 is the area of peroneal communicating nerve. Area number 2 is saphenous nerve. Area number 3 is the medial calcaneal nerve. So we have to mark area number 1 as the right answer. So we will go with area number 1 as the right answer, which is area number 1. Area number 1 is A. So definitely A is the right answer in this case. Okay. Now moving with the other options, B is saphenous nerve, which is not used for the it is not used for the graft. So generally it is not the right answer. Medial calcaneal nerve is basically giving innervation to the skin of heel and medial side of the sole. So it is also wrong. Posterior communicating area is mainly originating in popliteal fossa and communicates the lateral. So either from the communications from the lateral cutaneous nerve. Actually, ideally, if I talk about the area which has been shown and which is used for the graft, we have to go with the sural nerve, which is exactly considered as ideal area for the autologous nerve grafting. So we will go with area number 1 and A as the right answer. Okay, let's move on to the next MCQ, that is MCQ number 10. A 33-year-old boy is admitted to the hospital complaining of diplopia, double vision, when walking downstairs. During physical examination of extraocular muscles, the patient experiences diplopia. And when he is asked to turn his right eye inward towards his nose and look down, he is able to look inward but not down. Okay, he is able. So this is very important, that patient is experiencing diplopia and his right eye is inward towards the nose looking down. He is unable to look inward. He is able to look inward but not exactly downward. So which of the following nerve is affected in this case? So exactly we have to firstly identify what is A, what is C, what is D and what is B. ओके सो एग्जैक्टली हमें पहले तो आइडेंटिफाई करना है नर्व्स, देन ओनली वी कैन मार्क द करेक्ट आंसर. सो एग्जैक्टली द features which has been described, double vision and when he's turning his right eye inward towards nose and look down, he is able to look down but not inward. So they are particularly talking about trochlear nerve. So the marked B nerve is the trochlear nerve which is affected in this case, and actually the action which is affected in the extraocular movement of the muscles which is affected is the action of the superior oblique muscle. We know that SO4, superior oblique muscle, is getting innervation from trochlear nerve. So that is the reason the pupil is directed downward from adductor. The inability of the person is to perform the motion, and also the patient will have diplopia. Diplopia while walking downstairs indicates damage to trochlear nerve. So definitely B is the right answer, which is the trochlear nerve. So when trochlear nerve is damaged, the patient will experience diplopia. When looking downwards, vision is single so long and eye looks above the horizontal plane. So definitely the patient will have diplopia and defective depression of adducted eye, which was mentioned in the MCQ. So we will mark B as the right answer. A is not the right answer because A marked nerve is olfactory nerve, C marked nerve is optic nerve, and D marked nerve is oculomotor nerve. So that is the reason these are all wrong. Okay, so we have got olfactory, optic, and we have got B as trochlear and D as the olfactory. So definitely B is the right answer. Question number 11. All of the following nerves are associated with ocular movements except. Okay. So exactly A, B, C, D. It's a very easy one. You have to just identify the nerves and you have to tell me which is not associated. So we can see here A, B, C, D is there. So basically the nerve which is not associated with ocular movement will be the nerve lying here. This nerve which you are seeing will be running along the ophthalmic artery, optic nerve. So this is optic nerve. So A is the right answer. So definitely if you will see, we can correlate the image which was provided in the MCQ and we can definitely mark A as the right answer because optic nerve is not related with extraocular movement. Oculomotor, trochlear and abduction, these three nerves are related with the extraocular muscle movement. So definitely A is the right answer. You can correlate and you can see A is the optic nerve. You can clearly see if I'm talking about B, B is correlated with the with that of the oculomotor nerve here, and C is that of trochlear nerve and D is that of abduction nerve. So one side the image has been given to you. You can correlate with the image provided in the MCQ and you can get the right answer. Question number 12. Patient is having paradoxical respiration. Which of the following nerves will be affected? Recurrent laryngeal, internal laryngeal, phrenic and the vagus. A, B, C, D is marked along with the thyroid gland. So exactly अगर A, B, C, D की बात करें तो I just want you to show the same image of the cadaveric image so you can correlate on either side and you can mark the right answer. Okay, so अगर हम paradoxical breathing की बात करते हैं, so basically you have to go clearly with this you don't correlate with the image. Actually यहाँ पे image की बात नहीं है, तो directly ये question में paradoxical respiration की बात है, तो which of the following nerve is affected? So we know that phrenic nerve is innervating diaphragm and diaphragm, so that is the right answer. Other than that, thyroid gland के correlation में we can see the vagus nerve, we can see the recurrent laryngeal nerves. We can see the recurrent laryngeal nerve as the C. We can see the we can also appreciate here the vagus nerves on of right and the left hand side. So definitely in the neck, phrenic nerve is passing anterior to scalenus anterior muscle, and it will be, we have got right and left phrenic nerve which is having different course, but as a general rule they descend down keeping the mediastinal pleura in contact, and it is very important, it travels anterior to the hilum and bronchus of the respiratory side, and so definitely paradoxal breathing ki baat karte, respiration ki baat karte, that is seen in the case of phrenic nerve injury. So we will not mark these three as the right answer. So we have, so that is the reason A, B, C is all wrong, and we have got D as the right answer. Question number 13. Action of the muscle at the hip is give us the right answer. So basically, ye jo marked area, that is the gluteal tuberosity, and we know that gluteus maximus muscle is attached to this, and definitely the right answer will be extension and lateral rotation. So the marked area is gluteal tuberosity and the muscle attaches gluteus maximus. So action on the hip joint is external rotation along with the thigh, external rotation and extension. Superior laryngeal nerve, true statement are all except. So superior laryngeal nerve is superior laryngeal nerve has got two branches, external and internal laryngeal, supplies mucosa of lower half is wrong, because mucosa of lower half of the vocal cord is supplied by recurrent laryngeal nerve. Other than that, it gives a innervation, it injury can damage external laryngeal nerve is definitely correct. Pierces thyroid is definitely correct. And internal laryngeal nerve is also a branch of superior laryngeal nerve. So definitely the wrong option is A. The area supplied by the lower part of the vocal cord, sensory innervation is done by recurrent laryngeal nerve and not by superior laryngeal nerve. So we will mark A as the right answer. So it's also important that all the muscles of the larynx are getting innervation from recurrent laryngeal nerve except cricothyroid, which is getting innervation from external laryngeal nerve, and sensory innervation may upper part by internal laryngeal nerve, branch of superior laryngeal nerve, mucosa of the lower part of the vocal cord by recurrent laryngeal nerve, which is same shown in this image. Okay. So you can just be the part of this. All the best, keep studying, and I will again meet with a new session in which discussion of the next grand test 5 will be anatomy question. So I will be discussing all the anatomy MCQs related in all these subsequent tests. All the best, keep studying. Thank you so much.